with my computer, guys, and I tell you, prepare the topic obstetric operations, all obstetric operations, cesarean, maintaining the pregnancy, abortion, destructive operation, applying of forceps, operations which prepare the birth canal, everything. And I try to show you cesarean section tomorrow. Then, sexual crisis of newborn. Why we have this crisis? When the fetus was inside the cavity of the uterus, every time on the condition of the fetus influence the mother's hormones on placenta. When fetus go outside, appear outside the uterine cavity, due to the decrease of the level of hormones, we have the crisis. The organism of the fetus answer by their own production of hormones on this crisis to the decrease of the mother's hormones. Yes, and that's why we have this increase of both mammary glands usually. Here it is pathology, it is mastitis. Yes, in girls maybe desquamative vulvovaginitis, characterized by mucous discharge from the vagina or grayish-white color in the first 3 days of their life, or maybe sometimes bleeding to these hormone crises, and mothers usually afraid of this condition. But it is only pass without our engagement to this process, and usually appear on the 3rd day and disappear spontaneously. Then toxic or septic diseases, guys, in newborn. More frequent, which are suffer newborns, it is vesicular pustulosis, pemphigus, mastitis, and necrotic phlegmon of newborn. I very shortly show you this because we have such topic, the diseases of newborn. Very shortly, I remind you, maybe on when you study child diseases, you have this topic. Vesicular pustulosis, usually appear in the skin folds. Yes, no, here not clear picture you see here. Head, buttocks. Usually they are. It is a small vesicles and some millimeters in size. These vesicles filled first with transparent and then turbid content due to the inflammation. At the os of megascreen sweet glands, not mouth, os of megascreen sweet glands. Vesicles burst in 2-3 days after onset, and the erosion is covered with dry roots that leave no scars or pigmentation appear. Vesicles disappear, appear erosion, and they disappear without any scars and pigmentation. It is vesicular pustulosis. Not in all children. It is complicated, it is not a transient state about which I told you. Then, pemphigus of newborns. It is against the background of erythematous spots, bubbles up to 0.5 to 1 centimeter in diameter. They contain serous purulent liquid with a somewhat infiltrated base and corolla of hyperemia. Bubbles are at different stage of development, and after opening the vesicles formed erosion. If it is malignant form, complicated form, vesicles large can occupy 2-3 centimeters. The skin between the individual vesicles may peel off, and general condition, severe symptoms of intoxication is present. This is the picture of pemphigus of newborn, guys. Mastitis. We speak about the hormonal crisis, but here mastitis. Usually develops against the background of the physiological enlargement of the mammary gland and manifested by increase and infiltration of the breast. Hyperemia of the skin over the gland may appear. And sometimes, if we don't treat this condition, may occur fluctuation. Palpation of the mammary gland is painful. Purulent content are released from the excretory ducts of the gland spontaneously or upon palpation. And necrotic phlegmon, you see here terrible picture. It is one of the most severe purulent inflammatory diseases of newborn. Begins with the appearance of dense, red, rapidly spreading spots on the skin. In this case, purulent melting of the subcutaneous adipose tissues outstrip the rate of change of skin due to the extended network of lymphatic vessels and wide lymphatic gaps. You see here the affected areas become crimson with the softening in the center. Usually this condition needs treatment with antibiotics and maybe epithelialization with granulation with epithelialization, but with subsequent formation of the scars on the skin. Erysipelas, it is among streptoderma, erysipelas the most common. The appearance of the focus of the local hyperemia of irregular shape with first reached edges, skin and subcutaneous adipose tissues, infiltration present. The body shaft is absent. The skin is changed and warm on the touch. The lesion quickly spreads to other areas, and severe hyperemia behind the ears and the unnatural folds of the skins are possible. Frequent changes to brain-like peeling. Treatment consists in removal of pus with a sterile material impregnated in 70% solution of alcohol. Usually we use also antibiotics, antibacterial treatment if we have such form of changes of the skin. And conjunctivitis, it is more frequent among the diseases of the mucous membrane of the newborn. You see here the view. There are usually bilateral lesions with purulent discharge, swelling and hyperemia of the conjunctiva, and eyelid treatment is determined by the type of pathogen. It is we take smears and then determine what treatment, antibacterial treatment indicated. Very often the reason it is gonococcal infection and plus staphylococcus. It is more frequent microbes which affected the eyes. And amphalitis, it is inflammation of the umbilicus. Usually it is more frequent disease which further lead to purulent amphalitis, and the severe complication, it is thrombophlebitis. If we have amphalitis, this condition needs in local treatment. First of all, with using of antiseptic solutions. It is, you see here, inflammation of the umbilicus and view of the amphalitis. And sepsis condition, and one of the serious infection disease of newborn, sometimes due to hospital infection with present in the hospital, and but in most of cases it is the gates of this infection, it is the umbilical wound. Very difficult to, we have only 9 minutes, guys. When we stop, and I will meet with you at 11 o'clock, guys. We'll speak about the methods of investigation of the fetal condition. And for today, maybe over. Tomorrow, we will speak about the crop test and other topic. It is operations. I want to show you cesarean tomorrow. Guys, sepsis it is severe complication. Usually, if the hospital had sepsis, we close maternal house. Reason in most of cases, I told you, it is the infection of the umbilical wound, but maybe other reasons. It is trauma. Then it's maybe catheterization, it's maybe intubation of the newborn. Then it is sometimes very difficult to establish the gate of the infection, and usually we consider this newborn sepsis, we consider to be the cryptogenic sepsis due to the infection in the maternal house, because we don't know really the reason of this infection. Then, what is the specificities? If we speak about the neonatal sepsis, it is difficult to differentiate the sepsis from pathological conditions of non-infection nature. Maybe respiratory distress. It is the signs of respiratory failure, transient state. Do you remember? I told you about it. It's maybe bloating apnoea. It's maybe then cyanosis also present. Sometimes enlargement of the spleen and liver and jaundice present. And we don't know how to differentiate, for example, sepsis and rhesus conflict, because different treatment. Sepsis, it is antibiotics. Jaundice due to hemolytic disease, it is hemotransfusion. It's maybe swelling, and that's why one of the main, it's very difficult. And one of the main severe complications, it is septic shock. Usually, of course, we look for mandatory symptoms of meningitis. Usually it is the signs of development of the sepsis, and treatment, it is antibacterial treatment usually. You see here tactic of treatment, immunocorrection. First of all, it is antibacterial treatment and immunocorrection and correction of biocyanosis with using of guys, after the biotic therapy, we need to correct antibiotic with using of probiotics. You know what drugs I mean. Yes, guys, I want to pay you attention because we have no a lot time to asphyxia of newborn. If we speak about the loss of oxygen inside the uterine cavity, we set the diagnosis of hypoxia or fetal distress. If fetus was born, yes, according to the after this distress transformed to asphyxia of newborn. We cannot say that newborn has distress. Newborn has asphyxia. Clinical manifestation and severity we determine with the Apgar score. This pay attention to asphyxia because methods of reanimation of newborn include the question about asphyxia. Apgar score, first of all, we determine the condition of the newborn on the first minute after labor and on the 5th minute after birth. And pay attention to such things. Mild asphyxia, it is 6-7 points and up to the on the 5th minute. Then asphyxia of moderate severity correspond to 5-6 points. Yes, and if we have good condition of the fetus, favorable condition, it is more than 7 points. Low, up to 5-6 points, it is unfavorable prognosis for the fetus. And fetus, if it is less than 5-6 points, need in intensive care. And resuscitation of newborn. Guys, I recommended you to make photo of resuscitation because usually it is your answer on the question what we need to do if the fetus was born in asphyxia less than 5-6 points according to Apgar score. Guys, please do it, make the photo, or you can look in your books, you can find this information, what we need to do. Yes, you see, at first, it is oxygen treatment, then next stage, it is mask, yes. In the case of disturbances, after 30 seconds of ventilation, if there is no independent excursion of the chest and heart rate is not restored, indirect message of the heart and continuing ventilation using the bag for other 30 seconds. After indirect massage of the heart for 30-60 seconds, resort to ILV. The introduction of adrenaline, 1 to 10,000 isotonic sodium chloride solution, 4.2% sodium carbonate solution, 4 milliliters per kilogram. If within 10 minutes the cardiac activity of newborn does not appear against the background of continuous and adequate resuscitation measures, decision is made to discontinue neonatal resuscitation. No sense further because brain died. Guys, remember about these measures. You didn't pay attention to this, but it is, as for me, it is for you very difficult question on exams. Guys, now I stop my demonstration. And then we will meet at 11 o'clock and we'll speak about the 30 minutes. We speak about the methods of investigation of the fetal condition.